In this program, after a brief review of tooth histology, the pre- and post-eruptive stages of tooth development will be presented. Basically, all the information you should learn from this program, including your objectives, is outlined in your study guide. You may want to follow the study guide as you observe and listen to the slide tape. The study guide may also be used as a review for later reference and study. We'll begin with a brief review of tooth histology. The process of human tooth development is an interesting interaction involving ectodermal and mesodermal tissues. The ectodermal cells perform special function of enamel formation, odontoblastic stimulation, and the process of determining the shape of the crown and root. After performing these functions, these cells disappear. The mesoderm, however, persists throughout the life of the tooth and is responsible for the formation and composition of dentin, pulpal tissue, cementum, periodontal membrane, and alveolar bone. Unlike the ectodermal cells, these cells persist throughout life. This slide illustrates 4 steps in the development of a tooth. You can see that during development, the ectodermal tissue, shown in the slide in gold and red, surrounds and helps shape the mesodermal tissue in blue and yellow, which ultimately makes up the tooth. The life cycle of a tooth can be divided into 4 stages for permanent teeth and 5 for primary teeth. These are growth, calcification, eruption, and attrition, as diagrammed in this slide. For the primary teeth, there is also a stage of resorption and exfoliation not pictured here. The first stage is that of growth, a time during which the tooth develops from a shapeless mass of cells into the appropriate anatomical form. The second stage is calcification, a time in which the tooth, a shaped, soft mass of cells, becomes a calcified tooth. The third stage is eruption, which is that time when the tooth emerges into the oral cavity. The fourth stage is attrition. Attrition, as a physiologic process, is the normal wearing of the teeth through function. Resorption and exfoliation occur only in the primary teeth. In this stage of the primary tooth's life, the roots disappear and the crowns remaining are shed to make way for the developing permanent teeth. The growth stage is further divided into 5 distinct but overlapping periods. The 5 periods of the growth stage are initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. These names describe the physiologic growth processes through which the developing tooth goes. Initiation occurs during approximately the 6th week of embryonic life. At this time in utero, the basal layer of cells that lines the oral cavity begins to proliferate rapidly. This proliferation results in the formation of a ridge along the free margins of the jaws. This ridge is commonly referred to as the dental lamina. 10 ovoid swellings, the tooth buds of the 10 primary teeth, appear at intervals along this ridge of ectodermal tissue. The cells continue to proliferate and through differential growth extend downward into the mesenchyme, assuming an invaginated appearance, with the fold directed away from the oral epithelium. This invaginated fold is called the enamel organ. By the 10th week, this rapid proliferation has continued to deepen the enamel organ into a somewhat capped shape appearance. At the same time, the embryonic connective tissue immediately below the invaginating cap is stimulated to rapid cell proliferation, producing a segment of condensed cells called the dental papilla. From the dental papilla, at a later stage, will be formed the dentin and pulp of the tooth. Further proliferation of the epithelial cells at the deep margins of the cap expand the enamel organ to a bell-shaped appearance. At this point, the enamel organ consists of 2 layers of epithelial cells, the outer enamel epithelium, which corresponds to the covering, and the inner enamel epithelium corresponding to the lining of the cap. Separation begins between these 2 layers, with an increase in intercellular fluid. Stellate cells then form a mesh or reticulum, which will serve later as a cushion for the developing enamel-forming cells. At the same time, a fibrous tissue component, the dental sac, is beginning its development below this invaginated process and will eventually be responsible for the development of cementum, periodontal membrane, and alveolar bone. As the cells of the enamel organ continue to grow in both number and size, several layers of low squamous cells differentiate within the stellate reticulum and form the stratum intermedium. Histodifferentiation, the next process in the growth stage, is simply cell specialization. Cells of the inner enamel epithelium layer differentiate to become fully developed ameloblasts, hexagonal columnar cells which will lay down the enamel matrix. A large portion of the dental papilla becomes enclosed in the invagination of the enamel organ, and the outermost layer of dental papilla cells undergoes differentiation into odontoblasts. In addition, during this period, a budding takes place from the dental lamina lingual to the developing primary teeth, which will give rise to the succedaneous permanent teeth. These buds make their appearance from the 5th month in utero for the central incisors to the 10th month after birth for the second premolars. The tooth buds of the 3 permanent molars appear progressively distal to those of the second primary molar from 4 months in utero for the first molar to the 4th or 5th year of life for the third molar. Morphodifferentiation is shape specialization, and during the morphodifferentiation period, the cells of the developing tooth become independent of the dental lamina. The cells of the inner enamel epithelium assume a position with their bases oriented opposite the developing odontoblasts. At this point, they are functioning ameloblasts, capable of forming enamel. The basement membrane, which separates the ameloblasts from the odontoblasts, will, at a later date, become the dentino-enamel junction. The contour of the root is designed by the extension of the united enamel epithelium, commonly referred to as Hertwig's sheath, which projects into the dental sac mesenchymal tissue surrounding the dental papilla. During this morphodifferentiation period, the ultimate shape and size of the developing tooth is determined. The last of the 5 growth stages is apposition. During this stage, the ameloblasts move peripherally from their base and lay down the enamel matrix. This material is laid down in the same shape as the ameloblasts and is referred to as enamel prisms. The matrix is deposited in layers which follow a course generally parallel to the dentino-enamel junction. At the same time, the odontoblasts move inwardly away from the dentino-enamel junction, leaving protoplasmic extensions. The enamel matrix deposition cannot occur without the simultaneous dentin formation. The odontoblasts form a collagenous, uncalcified material known as predentin. This material is laid down in incremental layers. The remnants of the ameloblasts, as they reach the outermost layer of the tooth crown, degenerate to a thin cellular membrane, but the layer of odontoblasts remains around the periphery of the pulp as a permanent mechanism for the formation of secondary dentin. Following the laying down of dentin and enamel, there is increased activity at the deepest margins of the invaginated bell in the area of the dental sac, which initiates the formation of the root or roots and molds their shape. In summary, the apposition stage is one in which the developing tooth becomes 25 to 30% calcified, these calcified tissues being enamel matrix and predentin. The second major stage in the life cycle of the tooth is calcification, which has been defined as the time during which the tooth-shaped soft mass of cells becomes a calcified tooth. This stage is characterized by the advanced development of dentin and enamel, called dentinogenesis and amelogenesis. Dentinogenesis. The formation of dentin takes place in a 2-phase sequence. The first step involves the development of an uncalcified organic matrix called predentin, and the second phase involves its mineralization. Calcification of dentin proceeds at a rate which roughly parallels that of matrix formation. Thus, the width of the predentin layer remains relatively constant during this process. The calcification process begins at the tip of the cusps, or the incisal edge of anterior teeth, and proceeds inwardly. The basic mineralization sequence in dentin appears as follows. The earliest crystal deposition is in the form of a very fine plate of hydroxyapatite on the surface of the collagen fibrils and in the ground substance. Later, crystals seem to be laid down within the fibrils themselves. These crystals are arranged in an orderly fashion with their long axes paralleling the axes of the fibrils. Within the globular islands of mineralization, crystal deposition appears to take place radially from common centers. Amelogenesis is the development of enamel and involves two processes, organic matrix formation and mineralization. The enamel-forming cells begin their secretory activity after a small amount of dentin has been laid down. The first enamel matrix is deposited extracellularly by the ameloblasts in a thin layer along the dentin. Mineralization of the enamel matrix takes place in two stages. The first stage results in an immediate partial mineralization of the matrix segment, and the initial influx may amount to 25 or 30% of the eventual total mineral content. This first mineral deposition is in the form of crystalline apatite. The second stage, maturation, is characterized by the gradual completion of mineralization. The process of maturation starts from the tip of the cusps and progresses cervically. However, maturation begins at the dentinal end of each rod. Thus there's an integration of the two directions. Each rod matures from the DEJ to the surface, beginning with the most incisal rods and proceeding cervically. Eruption, attrition, and resorption were defined early in this program and do not